for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Good afternoon, guys. I have Melissa DeRosa, Robert Mejica, Dr. Zucker, Beth Garvey on the phone with me. We have a lot going on, so let me take through a couple of items. We're focused on vaccinations. We announced today the Roll Up Your Sleeves campaign, which focuses on the social equity campaign on vaccinations, making sure we're getting it to the communities that have been hardest hit by COVID. I did an event today in Queens on that. We are very aggressive in public housing, in churches, in community centers, in communities of color on the vaccination program. We have opened eligibility, so more and more people are eligible, and we now want to communicate that it's about making appointments, and it's up to you. It's up to you to get a vaccination appointment and get a needle in your arm. We're also working on the budget, obviously, and the budget is really a budget and COVID management and New York recovery program. It's the most complicated budget that we've ever done and the most important budget that we've ever done, because it's not a financial document primarily. It's an action plan primarily. Manage COVID, learn from COVID, reforms from COVID, and rebuild New York for this post-COVID world. On the COVID numbers, positivity was 4.3. We did 150,000 tests. 57 New Yorkers died from COVID yesterday on Easter. For those of us who celebrate it, they're in our thoughts and prayers. 4,400 hospitalized. That's up 61. 906 in ICU, 577 were intubated. The COVID numbers have basically been flat, slight uptick, slight downtick, but basically flat. When you look at where COVID numbers are in the state, and this to me is probably one of the most important pieces of information that we talk about. Number one in the state, Western New York, 4.7. Mid-Hudson, 4.6. Long Island, 4.3. New York City, 4.2. Finger Lakes, 2.6. Capital Region, 2.3. Mohawk Valley, 1.6. North Country, 1.6. Central New York, 1.3. Southern Tier, 0.7. Western New York back up at the top. That's on the 7-day average. In New York City, Staten Island, 4.9. Queens, 4.7. Bronx, 4.4. Brooklyn, 4.2. Manhattan, 2.6. Manhattan, again, the lowest in New York City. Staten Island, which at one time was the highest, then actually reduced, now is the highest again over the 7-day average. Western New York, if you remember, we had a real problem for a long time. Western New York, we communicated the message of the severity. Western New York improved. Western New York is now back on top. I'm not a scientist, but to me it is undeniable. But that behavior of a community makes the difference. Why do you have Manhattan at 2.6 and Western New York at 4.7? Why do you have Manhattan at 2.6 and Staten Island at 4.9? Why do you have the Southern Tier, which also had a dramatic rush of COVID at one point that was frightening for the state and for the Southern Tier? Since then, the Southern Tier has been very low. It is the behavior of that community. Wearing masks, social distancing, etc. COVID fatigue, I'm tired, the weather's warm, there's a vaccine, the death numbers are down, hospitalizations are down, I think we're over it. Yeah, the community that accepts that philosophy first will have a higher transmission rate. I get it. We all get it, COVID fatigue, except it's not over. And there are still variants, and you can still get sick. And yes, people are vaccinated, but not enough. And it is up to that community's behavior. It is the same theory as when we had microclusters, because the microclusters were saying you can identify behavior patterns by community, by neighborhood. And the microclusters targeted that behavior by neighborhood. And we targeted those neighborhoods. We closed down. We did heavy public education. People got the message. People said, oh, I don't want to get sick. They responded. Once people believe, well, this is over, COVID's not serious, the behavior changes, and you're seeing communities where we did have problems, and then we had a very significant public education campaign, but more importantly, they knew in their community they had an issue. They saw people going to the hospital. They saw on the local news every night numbers going up, X number died, and they responded. But people are now relaxing. And as people relax with COVID, it's a problem. I said today in Queens, what I've said before, don't get cocky with COVID. COVID wins when you get cocky. This is a formidable enemy. You put your hands down at your side, you think it's over, the enemy attacks. And that literally is community by community. Vaccines, we've done 10.5 million shots in arms. 1 in 3 New Yorkers have gotten at least one dose. Over 4 million have been fully vaccinated. That's about 20% of the state. Tomorrow morning, all New Yorkers, 16 plus, will be eligible. 1-833-NYS 4VAX, number 4VAX is the phone number. Or you can go online, ny.gov vaccine. The supply is coming from the federal government, start and stop, but this week it's up. We have the distribution center. It's continued supply from the federal government, and then it's citizen responsibility and citizen action showing up and rolling up their sleeve. We have 189 community-based pop-up vaccination sites. We have 13 mass vaccination sites operating now. We have 6 mass vaccination sites in partnership with the federal government. We have 69 churches that are now serving as vaccination sites. We're partnering with Somos, which is a doctors, physician network that runs community clinics. So we are hyper-aggressive on getting the vaccine to people and to communities of color who have had the highest COVID rate. The mass vaccination sites are the highest throughput sites, and we're trying to balance both. In other words, Javits Center has one of the highest throughputs of any site in the country. And Javits, people have gone to Javits Convention Center in Manhattan and gotten a vaccine. They all rave about the operation. The mass vaccination sites have the highest throughput. They are the most efficient. But you have to drive to the mass vaccination site. And we have them located throughout the state. But you have to go there. The pop-up sites, the community-based sites, we bring the vaccination to you, okay? So we go to your public housing complex. We go to your church. We go to your community center. And there we focus on reaching the communities primarily of color. They do not do as high a throughput, but they are more effective at getting the vaccines to the communities that actually need them. Today, we launched the public awareness campaign in connection with the Equity Task Force, which is the Roll Up Your Sleeves campaign. And it makes the case to Black New Yorkers, Latino New Yorkers, that this is safe. We're trying to get past that hesitancy and trust issue. And the Roll Up Your Sleeves campaign will be running statewide. We're also working on the budget at the same time. As I said before, the budget is probably the most complicated, the most ambitious, and the hardest budget that we have done. This is a post-crisis budget. We have federal funds, we have state funds, we have reconstruction we have to do, we have relief that we have to do, and we have to rebuild an economy in a post-COVID world where economies all across the globe are going to try to are all trying to rebuild. And in many ways, I think it's an international competition. Who can rebuild first? Who can learn the lessons first? And there's an opportunity for New York in that. So the budget, yes, state finances like a normal budget, plus COVID relief, plus COVID reform, learn the lessons from COVID, plus reimagine New York, reinvent New York. And those are the themes that I laid out in my State of the State and we put in the budget. But it makes it complicated. You put on top of that, you can't be in the same room with people. And yes, Zoom is great. Zoom is not as good as being in a room with 20 people and being able to sit there for 10 hours and hash it out. So that has been a complication to it. But there are many very important points in the budget. The legalization of marijuana was important. We got that done. The public safety reform plan has already been a success. 497 jurisdictions. About 90% have submitted reform plans to the state. 497. And we have about 450 plans in, okay? This is a remarkable achievement, and it is vitally needed. We talk about restoring New York, bringing the economy back, economic development, yes. But you know, the first question is the community safe? Is New York City safe? All this social unrest post-George Floyd, what have you done about it? Have you reconciled it? Have you resolved it? Have you learned from it? Because the tension is palpable between the police and some members of the community. And it's all across the country, by the way. George Floyd and the social unrest afterwards was not unique to New York in any stretch of the imagination. But New York is the first state to do something about it. And it's a difficult topic. And it's a no-win topic for the local politicians. and politicians tend to stay away from no-win topics. And that's why we said in New York, you must address this problem. Denial is not an option. And if you don't have it by the date of the budget, then you're going to get a monitor, there'll be withholding of funds, and people said, oh, this is very difficult, and yeah, except New York has made more reforms through a collaborative mechanism, more public safety reforms than any state in the nation. There is no other state that did this. There is no other state where you have 90% of the jurisdictions that have a police force having successfully completed a police reform, public safety reform plan, which had to be done through a collaborative and which had to be passed by the council of the city. So it's not just a lot of proposals and white papers and speeches and rhetoric. They had to come up with a plan. They had to pass the plan through the city council. Everyone complained, but you know what? 90% of the public safety forces in the state of New York are reformed, and that is a phenomenal victory. I am not saying that every plan is the be-all and end-all. I think some of the plans are just the first step and will need further advancement and refinement, but they were all passed by their legislative body and signed by their chief executive, and they are the first start at reform, right? Social unrest, demonstrate, legislate, reconciliation. Demonstration, legislation, reconciliation. There is a social injustice. Demonstrate. We saw the demonstrations. Legislate reform. Make it real. Stop the speeches. Real progress. Real results. Change the law. And that's how you get to reconciliation. 90% have done that in the state. Green energy is in the budget. That is going to make us the green energy capital of the world. The affordable internet is in the budget. Nursing home reform legislation is in the budget. So it really is very comprehensive. The houses, I applaud them. They've been working very hard under very difficult circumstances. I mean, when I talk about Zoom, I'm only doing it with the leaders. The leaders then have to turn around and they have to do it with all their members. So it's been a complicated process on top of a complicated product. But this budget will set the trajectory for the state for the next 10 years. I believe it. So we have a conceptual agreement on all issues, I think it's fair to say. The Senate, the Assembly, and myself, they are working it through with their conferences. We're dotting some I's, we're crossing some T's, but that's where we are. And with that, let me stop there, and let's take questions. Operator?
Participants, to ask a question, you will need to press star 1 on your telephone keypad. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Andrew Sif from WNBC.
Governor. Good afternoon. Today was about the fourth or fifth time you've held an in-person event at a vaccine center, which is closed to reporters citing COVID rules. And yet inside you have several dozen political allies and supporters. So why is it safe for them to be inside, but not safe for us reporters to be inside?
Well, as you know, Andrew, it's the total size of the population in the room, right? It's the total size of the group. You don't get two groups, one for the reporters and one for the people in the room. It's the total number of people. And we try to keep the number of people down, and we try to keep social distancing mandates. But the substance of the event is what is most important. Then being able to do questions like the way we are now with whatever we have, 40 reporters, 50 reporters, 60 reporters. I couldn't do that in a room. But the vaccination events, the substance of that event is to get the local community engaged and involved in getting the vaccines. It's about getting vaccines. Answering questions with the press, I can do through other means like this. Next question, operator.
Your next question, sir, comes from the line of Karina Jerry from WUTR.
Hello, Governor. How are you?
Good. How are we doing?
I'm great, thank you. So I wanted to ask you, under the current deal in regards to mobile sports betting, the Oneida Indian Nation will not be able to participate, possibly breaching the 2013 settlement that the state made with the Oneidas. And this could cost 10 counties in central New York millions of dollars a year, as well as the state as a whole. And lawmakers have said that you are the one keeping the Indian nations from taking part through the budget. Can you explain your reasoning behind denying them and costing Oneida County $20 million a year?
Is that what the legislators said? That I want to cost Oneida County $20 million a year? Why? How arbitrary and capricious must that be of me? How unreasonable, that governor. I'll have Rob explain the details to you, but just so you understand what happens. Mobile sports betting means you can bet from your mobile device, right? There are two ways states have done this, just so you understand the overall before I get to your specific with the Indian gaming. There are two ways to do it. You can give the casinos the right to run mobile sports betting. So you take the casinos in the states and you give them the license to run mobile sports betting, and then they operate it and they make the profits. They would pay taxes to the state, but the casinos make the profits. The second way to do it is the way we do the state lottery. We will contract directly with the mobile sports vendor. There's FanDuel, DraftKings, they have, this exists in other states, right? You can do this in New Jersey right now, but you can't do it in New York. We'll contract with them, and we'll make the money. We don't need the casinos as a middleman. That's the first point of contention. Should you let the casinos make the money, or should the state make the money directly? My position is the state should make the money directly, and then let the state decide what to do with it. With the Indian gaming, the issue is if you make a bet from your phone in a geographic area that is in a Indian gaming area, they don't get that revenue because you're standing in their area geographically, but the bet doesn't go to them. It goes through the state's vendor. So they don't get that revenue. That's a peculiarity of this type of internet gaming, right? It depends on where you're standing or where you're sitting when you make the bet. And that's what we've been trying to work through. If you're standing in an area that has Indian gaming, and that bet goes to the state rather than through the casino, that revenue goes to the state. Their claim is, well, since you're in their physical area, they should get that bet, the revenue from that gaming. Rob, do you want to take it from there?
Thanks, Governor. So yeah, the premise of the question is factually wrong. So we want all the counties to participate. We want the Oneidas to participate. We want to honor all the terms of the existing compacts, and we are actively working to draft the legislation that will reflect all of those principles. So that is where we are. We think we'll get to an outcome that will resolve that issue, and not those things that you said in your question.
It is complicated. Rob, can you explain the complication by the geographic location?
So the Oneidas have an exclusivity that relates to certain types of gambling, but without getting into that issue itself, because it is extraordinarily complicated, the way the draft of the bill right now is as the governor described, the state would contract with entities who would then contract with the state, and we would get the revenue, and they would conduct the online gaming. As the governor described, the question is, if there's a bet that takes place, right, in physically, if the person happens to be in a part of the state, where does that bet actually take place? And these are legal questions. We think at the end of the day, we want to come up with an agreement that respects the views of the Oneidas as well as all the counties, and make sure that revenue goes back both to the state and gets shared in different ways. And there are a lot of these agreements are actually not just with, there's some of these entities actually have their own agreements with private entities. So it's not that it's, who's participating. Some of these entities that the governor described who actually do the sports betting also have their own separate agreements with casinos or separate agreements with some of the nations. So that gets complicated as far as where's the state agreement ends and where those agreements begin. So at the end of the day, it's an RFP that the state is drafting. Those will compete in the RFP, and we think that when that selection is finally done, will result in a way that actually respects both, again, that respects the sovereignty of the nations, respects the compacts, and also enables the state to get the portion of the sports wagering that it will get from all of the other counties as well.
Yeah, it is, and just to add one, it is a unique development. In the old days, if you were standing in Oneida County, and if that area had exclusive gaming to the Indian tribe, you bet, the bet was placed at the tribal facility. Now you're standing somewhere, but you do it on your mobile device. It happens over the internet. Where was that bet placed? Is it placed on the internet and therefore to the state, or because you were standing in Oneida County, even though you're not in a casino, you were at home in your living room? Where does that revenue go? That's what Rob was referring to when we're trying to work out. Operator, next question, please.
Your next question comes from the line of Tyler Brown from WAM Channel 13, Rochester.
Hi, Governor Cuomo. How are you?
Good, buddy. How are you?
I'm doing good. Thank you for asking. So 2 weeks ago, I actually asked you this question about the CDC revising their school distancing rules, the 3-foot distancing. 2 weeks ago, you guys told me that you were reviewing those regulations, and so far there have been no changes. A lot of superintendents are very frustrated, and they know that they can't do the 3-foot distancing and bring more students back to school full time with this barrier rule in place. So what's the holdup? What's taking so long to change these rules and get more kids back in the classroom?
Good question. I'm sorry you had to wait 2 weeks. Dr. Zucker, do you know the answer?
We have been reviewing this. I know Beth's on the line also, and every school is a little bit different on this, and we need to work with the local school districts because, as I mentioned once before, we need to look at the environment of each classroom and to make sure that there's no potential for spread within that community.
Beth, do you know where we are?
Yes, so Department of Health has been working on this. We have been consulting with local districts, superintendents, with SED, and we are finalizing our review, and it should be done shortly.
How would you define shortly, Beth, to put you on the spot?
If we had to define shortly, I would say sometime in the next 24 to 48 hours, Governor.
Oh, I wouldn't go that rush. I would say within a week, there will be guidance. And then if you're right, 48, 72 hours, then we're going to be early. But Tyler, it's not as simple as you suggest. Some superintendents like it. Many superintendents don't like it. Some parents like it. Many parents don't like it. Some teachers like it. Many teachers don't like it. So this is not, the reason it has taken time is it is very controversial. And I would just suggest you note that, because if you stake one position, you will get many comments. I promise you, because I have. Operator, let's take one more.
Yes, sir. Your last question comes from the line of Emma Whitford from Law 360.
Hello.
Hi there, Governor. Thank you for taking a quick second. I'm writing a story about negotiations around the federal rent relief program, and I'm curious if you could speak to, where you stand on, whether landlords should be required to participate in the program or have to opt in.
Let me ask Rob or Beth, who are in the midst of that now, and they have more updated information than I do.
Thanks.
Rob, Beth?
Yes, so we are finalizing, the language on rent relief. We expect that all landlords will want to participate in order to ensure that they do receive payment for these tenants who have been unable to pay. We think that this is a very generous program, and we fully expect that all landlords will participate. We are, however, building in protections to ensure that for landlords that do not participate, that the tenants are nonetheless protected if they were eligible and had funds allocated to them under the program.
Well said. All right, we're going to go back to the grind of the budget. Keep your fingers crossed. Thank you all very much for taking time to be with us. Thank you.